Payer-provider partnerships are more popular than ever. Innovative collaborations can create access to new financing models and models of care, delivering solutions that go far beyond just volume and fee-for-service. Today, I'm talking with Dr. Will Shrank, Chief Medical Officer at Humana, about the different roles each partner plays and the promise of effective collaborations between payers and providers to transform health. Will, thank you for joining us.
Oh, great to be here.
Will, you've had roles in nearly every part of the healthcare sector. What's the common thread that feeds your connection to purpose in all of these roles?
I think that's a backwards way of saying that I'm having a hard time holding down a job. I think the great thing about working in the healthcare industry right now is there's just so many opportunities to identify inefficiencies and misalignment and work on it. And we're all, wherever you are in the healthcare system, you're focused on trying to deliver better care, better experiences, better outcomes at lower cost for our members, for our patients, our members, our Americans, our beneficiaries, whoever it is, whatever you're calling us. And everywhere I've been, I felt like I could really sort of believe that that's what I was doing all day. And increasingly, it's clear that all of that work is aligned regardless of where you're sitting.
All right, so what about the inverse of that question? What's the biggest difference between being on, say, the payer side or the retail clinic side versus maybe the hospital health system provider side?
It's a good question. So, I think there's been a lot of conversation about waste in the healthcare system. And one person's waste is another person's profit. And wherever you are, there's wherever you are, there's the potential for incentives that are misaligned, that are not necessarily creating the most value for patients, but that offer sort of financial value for the organization in which you sit. I would say that the more we move towards the value-based arrangements that Andy, you and I worked on together when we were at the Innovation Center, and which are now, continuing to expand and grow, and certainly have gotten more visibility. And the faith in value-based arrangements has only grown during the pandemic. There's more and more reason to believe that there are models for us all to get aligned together around those shared outcomes, to make sure that our incentives are to do just that: better care, better experience, better outcomes, lower cost for patients. There is enough waste out there that we can all do better and do better for our patients by doing that.
Well, speaking of value, we often talk about all the different stakeholders in the value equation, but from your perspective, Will, how do patients start to capture some of that value?
Well, I think lots of times it's invisible. That there's sort of the sense that if providers and payers are all aligned, that the recommendations, the care management, the whole process, that longitudinal care of the patient, better prevention, keeping patients healthy in the first place, the incentives for those activities will be in place. But my sense is that what patients increasingly are going to feel is that in a world where providers aren't trying to crank through RVUs, where it's not about productivity, where it's about experience, we're going to move a healthcare system from what is today really about improving or streamlining the workflow for the provider to really streamlining the experience, if you will, for the patient. And I think the more that we're delivering that sort of seamless, integrated, convenient, community-based care in the home, that's going to support our providers in sort of their activities every day, the kinds of care that's going to be technologically enhanced, so that there is digital, seamless ways of providing virtual care in the home, that care is just going to be easier. It's going to be easier for patients. And that, I think that should be it should be easier to be healthy. And a good value-based arrangement, a good value-based healthcare system well, it should deliver those results, make it easier for our patients to be healthy.
So since I've known you, you've always taken this partnership approach to transformation, and now you're at Humana, obviously a major payer. What's the biggest change, if any, since COVID around how you've thought about partnerships and how you've approached transformation via partnerships?
I think COVID has just been this beautiful, beautiful opportunity for the healthcare system to recognize that we can do better by working together. The pandemic really shined a light on all of these deep faults, these deep fault lines in our healthcare system, and certainly in our public health system. And it forced us, whether you're a payer, whether you're a health system, whether you're a primary care doc, whether you're a lab company, whether you're a pharmaceutical manufacturer, to really think much more holistically about where you fit in the system, how you share data, how you partner at the very outset of whatever it is you're trying to sort of generate, to be partners. And I think I've never seen this level of deep integration, partnership, collaboration, oftentimes with folks that we historically haven't partnered with. I would say the sort of the straightforward answer is providers that were in our value-based arrangements with us have weathered the storm a lot better than those that haven't. That some of the sort of more straightforward ways in which payers and providers collaborate have been reinforced and only amplified through the pandemic. But I think more broadly, I haven't seen this level of collaboration and partnership and true commitment to improving population health in my career. And I've found it just to be incredibly reassuring and invigorating, in fact, as an environment to try to do the right thing for our members.
Great. I love it. All right, last question. Well, you've had a storied career in research and as public service, as a provider, obviously at CVS and now at Humana. So what's your best piece of advice, or what's the best piece of advice you've gotten about pursuing a career in healthcare, specifically healthcare innovation?
Oh, I think it's really to be comfortable with ambiguity. I think you'd probably agree, and the time we spent working together, that it is really hard to predict how all the pieces are going to come together or what the challenges are going to be. And it doesn't really matter if you're at a startup, you're at a big company, you're in the federal government, you're a researcher. Every other day, something's going to come by that's going to make you think, "Oh my God, this is all the stuff I've been working on isn't actually going to work." But these things are hard to predict. Hang in there. Believe in what you believe in, and believe that we have a role to play to make healthcare better, and keep your head high, shoulders back, and do your best.
Really well put. All right, Dr. Shrank, thanks so much for joining us.
Andy, it is always a pleasure. Anytime.